If we talk about cancer cases in women, then one of the most important and most reported cancer is the cancer of breast. Earlier, it was considered to be a disease of Western countries, but now since we have got awareness and people are coming to the healthcare system, we are finding even in India, this is the leading type of cancer among the women. From public health perspective, I'll be discussing how to control and how to prevent breast cancer. I am Dr. Pranav. I am HOD of Public Health Department in GD Goenka University, and in today's discussion we are going to talk about the breast cancer cases. So, as we understand, cancer is a type of growth of tissue which is uncontrolled. So, cancer cases, they are mostly determined by a nodule, a tumor that is going absolutely unchecked. It's growing to an extent that it can spread even to the different places. So, breast cancer is the kind of taboo. It was involved about discussion on the topic. So, it was not earlier reported at big length, but now it is being reported because government and different NGOs are now talking about it, creating awareness so that we are having more and more patients who are coming for diagnosis and screening. If we talk about the early symptoms, so any nodule, किसी तरह की गांठ अगर पाई जाती है तो आप सस्पेक्ट कर सकते हैं. It can also be a case of breast cancer, but there is a mark of caution that not all nodules, not all tumors are cancerous. So the best way is we encourage in public health that all the young children, young girls starting from the age even 18, they should at least perform at the convenience of their homes self-examination, that's called breast self-examination. So that can be performed every month at least to get the early symptoms. Thereafter, if there is a change in skin texture, if there is dimpling of skin, or if there is an abnormal discharge, nipple discharge is there, so we can suspect that it can be a cancer. But as I say, sometimes and many times the cancer can be asymptomatic, like there is just no symptom of breast cancer. So in public health, the first and foremost thing that we promote is, if there is any nodule, any skin change, if there is any change in nipple, you should consult your physician and get yourself examined. The second public health step about breast cancer prevention can be early screening. So all the women who are above the age of 40 years, at least they must get a mammogram done once a year. And if you have some nodules and if your physician suggests, you can get it even at earlier age. Now coming about the risk factors, so the most important risk factor is having obesity, some culture where alcohol consumption is higher, that has also been documented as one of the causes that increases the risk of breast cancer. 2 genes have also been identified which make people vulnerable for breast cancer. They are BRCA1 and BRCA2. Beyond that, as we discussed, obesity is there as a risk factor, consumption of alcohol is a risk factor, and if the development of menstrual period started before the age of roughly around the age of 12, or if it ends around 55, then again there is increased chances of getting breast cancer. Smoking also increases the risk. So if you are indulging in any of the risk factors talked above, you should stop itself right now. Stop taking alcohol. If you are obese, control your weight. Get yourself examined for the genes that make you vulnerable for breast cancer. With these techniques at least we can reduce certain chances of breast cancer. But even right now, scientists do not really know, like the way we know that tobacco is behind respiratory tract cancer. So same way, we haven't yet been able to identify which are or what exactly is the mechanism of development of breast cancer. So as public health scientists and physicians, the best thing that we suggest is screening the cases early, because if we are able to screen it early and if we are able to detect the breast cancer at early stage, there are all chances that the case can be halted. That means the development of cancer can be halted through the use of different surgical process or different radiological process or certain chemotherapeutic process, that's taking the help of drugs and medicine. So to all the viewers and all the public health scientists, I would request we must create awareness about this kind of cancer, because right now in India and across the globe, it is the largest number of cases are coming from breast cancer, and screening only is the safest and best tool available. So promote screening and keep yourself safe. Let's make India healthy, one community at a time. Thank you all.